Good morning, good afternoon, everybody, and welcome to this presentation. I think some of the people will be hearing me twice in the day. We had a presentation this morning on Tajikistan, on Nimba trials, and now this is the second one in the day. Very glad to be present on this UN Behavioral Science Week, and very proud to present my team's work in the region as well. So today's session, we're going to look at complexities of hunger and nutrition and the evolving or rather consolidating role of behavior change in World Food Programme activities. We start with this as a nutrition activities, but today's session's objectives are to see how overall WFP is leveraging behavior science to accelerate progress toward SDG 2, zero hunger. Please write from where you are listening or joining us today in this call so that we know how far we are reaching around the globe. Some of you know the session will be recorded as the new policy we have so that people who could not join due to various reasons can listen to it, and we can also look back at the questions if you have missed to answer them later on. So, who will be presenting today? Myself, Nitesh Patel. I'm the regional advisor, nutrition advisor based in Cairo for World Food Programme. We have Ravina Merritt, who is our behavior science expert and the pillar of the work in the region. We have Nihal Nasruddin from Palestine Country Office, who is a food technologist and a nutrition specialist. We have Lama Majli from Jordan Country Office. And we have Hajra Hafizur Rahman, who works along with me in Regional Bureau of Cairo of World Food Programme. WFP's agenda today will be looking at what is WFP doing around in the globe, what are the issues at the regional level in terms of nutrition, and what are our approaches towards behavior change. Then we will look at the 3 countries where we have done the behavior research work in Jordan, Palestine, and Tunisia. So WFP works, as most of you know, and those who don't know, WFP works in 80 countries around the globe, almost 15 million people with food assistance, either in kind or by cash. However, with the current pandemic, you see the people in different countries are in need of food assistance. And the current estimates are that by 2030, there will be still 840 million people which will be hungry. So how to avoid this and bring it to zero is a big challenge. And you can see that pandemic has disturbed a lot of plans which were done 10 years ago or 5 years ago. WFP in the region, and we are focusing more on the nutrition side because that's where the behavior work is anchored right now, even though behaviors change communication could be cross-cutting around WFP works, but we are starting with nutrition as an entry point, as a thematic. So what is this issue in the Middle East and North Africa? If you look at the figures, there are 7 million children who are suffering from chronic malnutrition. There are 3.7 million children who are suffering from acute malnutrition. Among those, 1.6 million which are severely malnourished, meaning at the edge of death. There are, at the same time, you have 5.4 million children under 5 which are overweight. This number is now up by 3.4 million in the year of 2000. So you can see there are 2 million children already more overweight in the MENA region. And if you look at the statistics from the different region, MENA region comes as a second in the world for the overweight children under 5 years. The estimated rate of stunting and wasting as well in the MENA region looks a little bit lower, around 15 and 8%. But if you go and look in the numbers for Yemen and Syria, as you know, these rates will be much, much, much higher. So at the same time, you see in the region, there's a lot of overweight and obesity. It is increasing. Currently, that percentage is at 11.2%. It is also seen from the figures that 38% of the children under 2 received adequate diet diversity, and only 21% met the minimum acceptable diet, which are very, very low figures. And then we talk about the breastfeeding. It's only 31% of the children under 5 are exclusively breastfed, which is another shocking figure which we see in terms of child health and nutrition. So what are we looking at, and what are we doing for this in the MENA region from WFP? So WFP has reached, if these figures are the recent ones, yeah, WFP has treated and prevented 2.8 million children and 2 million pregnant lactating women. We have distributed a lot of nutritious food and also cash to improve the dietary diversity. What we have done in the recent past, in last 3-4 years, is that we have implemented 5 nimble trials to build evidence for social behavior change. We have developed 5 national SBCC strategies and campaigns. We have run 28 training courses and trained over 180 people. And we have engaged with more than 1,000 WFP beneficiaries in the co-creation of SBCC strategies and the nudges. So this is what we have achieved in past years. And this is where we are working in the region on specific behaviors and specific issues. In Tajikistan, we are working on improving hand hygiene practices. In Iraq, we are focusing on reducing cooking oil. In Palestine, which you will hear later on, we are looking at increasing consumption of high iron foods. In Algeria, we are looking at improving health and eating habits to boost immune systems of the Shahavis refugee. In Armenia, we are trying to see if we can increase consumption of healthy breakfast among the school-aged children. In Jordan, we are targeting reducing sugar consumption, again, among the school-aged children. What we have also done at the regional level from the region office is we have created targeted messages on COVID prevention, very clear messages which people can understand and implement on by creating postcards, by creating videos. We are also working on improving dietary diversity through complementary feeding in different countries. And lastly, in Tunisia, we have done an innovations project where we have brought in a behavior science aspect. This is the first time you can see in WFP's innovation project, a behavior science has been used to understand how your innovations would be accepted or would function at the client level, at the beneficiary level. So before we go on, let me hand on to Rowena to talk about little bits of nitty and the work we do at the technical level. Over to Rowena.
Thank you very much, Nitesh. As Nitesh has been mentioning, we've got behaviour change projects going on in about 6 countries across our region. And with all of the projects, we've recognised that there is a need to create positive demand for healthy foods. So they are demand creation initiatives. So we've moved away from the traditional simply supplying healthy foods at the right price, etc. And we've moved beyond education as well, beyond the standard toolbox, which is often used. And we've tried to create a more innovative whole systems approach to behaviour change, where we use a mix of interventions to support behaviour change. We create nudges and environmental changes, and also look from a top-down point of view with control and policy initiatives. Next slide, please. To do this, we've taken a slightly different approach. So often what happened in the past is we relied on external consultants, and the external consultants would come in for a set amount of time. They would do often a very good job developing the behaviour change programs or developing a behaviour change strategy for country officers to then implement. However, when they left, there was a lack of legacy. There was a lack of local skills at a national and regional level. And this meant that often projects faltered or just stopped altogether. So we wanted to change that approach and really focus on building capacity at a national level. And we did this by a learning by doing model. So instead of the traditional kind of theory-based, classroom-based sessions, we wanted to take people and mentor people throughout the whole behaviour change process to help them work on live projects. And then when they had experience in their own country offices, they could go and support other country offices within the region and hopefully in the future across the wider WFP network. This helped us develop a rapid evidence base for SBCC and for social behaviour change activities that was unique to WFP and unique to the issues we look at within WFP. And for me, most importantly, it was about creating a community of practice. So about creating a group of like-minded, passionate people who want to use social behaviour change within the WFP setting and have the skills and the confidence and the self-efficacy to use the tools and the techniques. Next slide, please. So as Nitesh was showing you, all the different country offices have a different focus for their behaviour change projects. However, they all follow this planning process that is detailed on this slide. So the first thing is about understanding the problem that we're looking to address. And most importantly, then defining the exact behaviour, creating a smart behavioural goal that we want people to do. Because often we ask people to do multiple behaviours or ambiguous behaviours, such as you need to eat a healthy, balanced diet, but everybody will interpret healthy, balanced diet differently. But we know from the evidence that if we ask people to do a very clear-cut, kind of very simple behaviour, they are more likely to achieve that behaviour change. And once they've achieved one behaviour change, then we can encourage them to achieve other behaviour changes because they've got that self-confidence. So that's the first step. The second step is then to understand the problem from the target audience's perspective. Now, this is really important because, first of all, our target audience might not even see it as a problem. You'll hear from a case example in Jordan soon where actually, you know, a chubby child is seen as a healthy child. But we also look at nutrition in the wider determinants of people's lives. We look at the social, behavioural and cultural dynamics that influence our nutrition and dietary choices. Again, this is really important because people don't think about nutrition in silos, but sometimes we think about nutrition in silos, and we can't achieve behaviour change if we continue to do that. Once we've got those key insights from that target audience understanding, from that formative research, we apply this understanding to create a mix of interventions. And as I mentioned before, these might be products or services that support the behaviour change. They might be design nudges that support the behaviour change, or they might be control mechanisms, but they're definitely not just an educational intervention, because we know telling people what they should and shouldn't do just doesn't lead to sustainable behaviour change among most people. To do this work, we do a lot of co-creation, and we'll hear about this again with the case examples that we're going to share with you next. Then we do real world iteration, and this is where we use nimble trial methodology to get quick and speedy feedback on what works or what works best within different contexts. And finally, we do an evaluation, moving beyond the traditional reach data that's often collected to look at the more medium and longer term sustainable changes with behaviour. Next slide, please. So we're going to now start with a case example from Jordan, but I just would like to ask you a question, and if you could put in the chat box your answers, please. How does Pepsi or drinking Coca-Cola or Fanta or 7-Up, whatever fizzy sugary drink you like to drink, how does it make you feel? So how does drinking Pepsi make you feel? And if you could answer in the chat box, please. It makes you feel alive. That's one of the comments. Or the caffeine and sugar in it. Any other comments? How it makes people feel? Makes you feel young. I think Pepsi makes me feel a bit young as well. Happy makes me not feel like I'm not taking care of myself, maybe a little bit guilty in that respect, because we know we shouldn't drink it, but then we still do sometimes. So this is a really interesting question, because when we asked young people and children in Jordan, how does it make them feel? They said, it makes me feel happy. It makes me smile. They really liked it. And it's really important that we understand that if we want to get behavior change, because we can't just say, look, here's a product that makes you happy and makes you smile, and we want you to stop drinking it and just drink water instead. They're just not going to change their behavior. So we have to understand the competition, you might say. We have to understand the benefits they get from some of the behaviors that we want them to change. And then we have to replace those benefits with something as good, if not better. And it's not about having a product like-to-like exchange. It's often about an emotion or a feeling. And that's what we're going to hear next about with Lama and the case example from Jordan. So over to you, Lama.
Thank you, Rowena. Good afternoon, good evening, everyone. So we're going to discuss the case of Jordan. And if we can move to the next slide, please, Hatra. So here you can see we're rethinking of the problem. So as a background for Jordan, we're trying to integrate.
Lama, I think you need to adjust your mic again because it's going in and out. So maybe if you can move closer to the mic. Thanks.
I'm trying to be very close. I think there's an issue. Okay, I would assume this. So, no,
we can't hear you. No, it goes up and down.
I'm trying again. Is this better?
Yes, this is better.
Okay. So in Jordan, we opted to start with the school, with integrating SPCC within our school feeding program to target children aged between 6 and 12. So within the school feeding program, WFP, along with the government of Jordan, we're providing meals to around 500,000 children in Jordan, including Syrian refugees. So at the start of the process, the focus was on micronutrient deficiencies, and in particular anemia. And we discussed various potential behaviors that would lead to the development of anemia in children, such as the drinking tea soon after meal, that would also affect the absorption of iron. However, after we started the SPCC process with the formative research, we realized that the problem is more around sugar consumption. And we realized that we needed to shift the prioritization from moving from the drinking of tea to more of focusing on the issue of sugar. So our main focus is reducing sugar consumption among school-aged children. And we wanted the approach to not be a one-off activity. So we wanted people, our targeted audience, to be involved in the process of developing the behavioral change approach. So the interventions are created by the community for the community. And through that, we did, the approach was in-depth qualitative interviews, observations, and co-creation. Next, please. So in terms of doing so, we asked a few questions. So we needed to understand what moves and motivates people. And it was important not to ask about nutrition in isolation, because most of us, we know what we need to eat and we know how much and when, etc. And all of that is driven by our social and cultural norms, existing habits, and so on. So some of the questions that we asked here are, what pictures express your challenges every day in getting your children to eat healthier food? And what does a good mother look like to you? And what makes you smile? So we wanted to capture the emotional drives behind the behaviors. Next. So by asking these questions, we were able to understand what were the emotional barriers and enablers, and how food fitted into people's day-to-day lives and social norms. And the main key behaviors were that parents often felt guilty for the situation that they were forced to live in. And that was more notable in refugee camps in particular. So we're talking about Syrian refugee camps. And parents or caregivers, they felt guilty for what the situation is, and then all the war and the displacement and everything that they went through. So they wanted to compensate the children very quickly to make them feel better. And the children, children are very smart. They understood this and they pester their caregivers. And parents were fearful of their children making a scene at a shop, throwing themselves on the floor and making a scene. So giving them that fizzy drink or the cake would make them feel better, and it would solve the problem quite quickly. And as mentioned by my colleague Rowena previously, there's an issue with perception here. So in Jordan and in the area in general, a chubby child is perceived as healthy. So the perception of being unhealthy is more around a child that is underweight, and a chubby child is considered more of healthy and having some fat on them. So these behavioral insights were used to develop a strategy that takes a whole system approach, including top-to-down policy initiatives. And that's why we also, in these discussions, we included other UN agencies that work in this domain, the government, such as the Ministry of Education, the Ministry of Health, and also civil society and NGOs working in Jordan. All these interventions are supported by an umbrella of social marketing campaign. So the messages used humor, empowerment, and positive reinforcement. And our slogan for this was, or is, no means yes, and motherhood for life. And to give a background of this slogan, it emphasizes that by saying no now, we're saying yes to a whole future of positive activities and outcomes for our children. And that by giving sweet foods, sugary drinks, and snacks to children now, mothers are creating habits which will lead to a lifetime of illness and diseases for the children in the future. Next. So moving people along the stages of change, as you can see here in the slide, research showed us that people currently have no perceived need to change. So we used the theory of planned behavior, recognizing that people are currently in the pre-contemplation stage, and we need to move them to the contemplation and then to the action stages. Therefore, the campaign is designed to be delivered in 2 stages. So stage 1, it's by creating the right preconditions for behavior change, which includes creating awareness that too much sugar consumption has health consequences, and redefining what being a good mother looks like, and that sometimes being a good mother means saying no. And the second stage is supporting people on a behavioral change journey. This stage seeks to inspire people to believe that change is possible and convince them that a change is already happening. So stage 2 of the campaign focuses on sugar swaps. And I think Rowena just briefly touched upon that. It's easier to offer swaps rather than just saying no or banning a certain type of food. As far for operationalizing the SPCC strategy and the campaign, we're hoping that schools would reopen next semester as schools were off all throughout the pandemic. And we would start, or we would resume distributing our healthy meal to children in schools. And we would also then integrate the SPCC within our school feeding work. Thank you.
Thank you so much, Lama. So with that case example, as Lama was explaining, we did co-creation, but we didn't want to do co-creation by just having to get people to do verbal responses to everything, because sometimes it's hard to articulate how you're feeling. And so you just give the standard answers that you think WFP would be interested in. So what we did with that, as Lama was explaining, is we tried to use art and creativity, images, so the women that we were interviewing, the mothers that we were interviewing, could clearly explain how nutrition and how trying to get your children to eat certain foods made them feel, whilst also understanding, you know, what moves and what motivates them in their day-to-day lives, what makes them smile. We did a similar thing, but for a different area with the project we're about to share with you now. So this project is from Palestine, and my colleague Nihal is going to present it. Now, this project is looking at iron-rich foods. So if you could put in the chat, can you name one iron-rich food in your daily diet? And I can see there's quite a few people from WFP here, so I'm sure they should be able to do that. Apricot, spinach. Yes, I think Popeye is priming you all a bit. Pulses, yeah, very much. So there's various healthy, fresh foods and pulses, etc., that can be consumed, beans, etc., that are high in iron. But often people, when they think about high iron foods, they think about red meat, and they think that, you know, that's really not affordable. So this whole project was about challenging people's myths and misunderstandings around what high iron foods actually look like, whilst trying to create a positive social norm within local communities so that changes can be made and sustained. So over to you, Nihal.
Thank you, Rowena. And by saying that, actually, and as was mentioned by Nitesh, the main and major malnutrition issue that is predominant in our region is micronutrient deficiencies, and specifically anemia, which is the low iron in blood. So next, Harsha, please. So in the past, WFP has focused on educational interventions to try and encourage people to eat high iron foods, such as pulses and certain vegetables. As many of you mentioned in the comments, high iron is, or iron food is not only found in animal sources, which might be expensive like meat and liver and chicken, but it's also found in legumes like lentils and beans, and leafy vegetables like spinach, which might be affordable and found in every house. However, although people like attending these sessions and they find them very really sociable, and but we didn't find them effective. Despite all the efforts, we have not made the progress that we needed. And based on that, we decided to change our approach and to think differently in building, or let's say in designing our projects. Next. So accordingly, our project is mainly aiming to increase the consumption of high iron foods. This includes many foods, as I mentioned, not only animal sources, which might be expensive for people, but also vegetable sources of iron, like pulses. So we had a behavioral focus, which is to increase the number of pregnant and lactating women and children under 5 who consume, I mean, iron-rich food groups. And we have chosen this pregnant and lactating, this target group, considering them the most vulnerable in Palestine and with the highest rates of anemia compared with other target groups. Next. So in order to understand, or let's say, as WFP, we already knew what is going on, but we didn't know why we have these high rates of anemia. Accordingly, we decided to conduct a barrier analysis and a behavior survey, and as well in-depth interventions to help us to understand more what are the emotional and social barriers, and as well the possible motivators in order to increase the consumption of iron-rich foods. Next. So, as mentioned in Jordan, and it wasn't really surprising for us, but what we have found that people didn't see that there's any need for them to change their diet or to change their children's diet, although they had great ambitions for their children. But mainly these ambitions are linked to academic ones, not other like academic, to be well educated, to be well paid, but they never associated what to eat with the academic. There was also a sense of frustration at their situation, and that the last thing that they wanted actually to have another UN agencies to come to tell them what to do or what not to do, because they already knew what is the best for them and what they have to do. So there was low self-efficacy and high isolation, which needed to be overcome and to focus at through our interventions. Next. So based on the insights and the results that we got from the formative research that we have conducted in West Bank and in Gaza, a full and comprehensive behavior change implementation plan was developed. And this behavior change implementation plan has included several and different interventions that focused on an overarching call to action. We designed or came up with a slogan, "Your little wins add up to big things." This message was very important, as just telling people it is easy to make change, but it doesn't always work. It doesn't necessarily work. So these small changes were not perceived as being really easy. So instead, it was about focusing on every small change and celebrating even the smallest change that is made by the mother mainly, and the family in general. So as well, the campaign was supported by interventions which were social events for mothers to try and break the isolation, such as cooking classes, cooking contests, which was a great way to get out of the house and to meet people, socialize, learn from peers, and help fellow mothers. And the interventions also had messages which focus on the first of children, such as the first step, the first word, the first day at school, as the research showed us that the mothers value and love remembering their children's firsts, and really appreciate and smile actually when we ask them about what they really remember. When they remember the first of their children, we saw the smile on their faces. Thank you.
Thank you very much, Nahal. And that project currently is being piloted and rolled out on a small scale, and then will be upscaled shortly. Next slide, please, Hadra. Thank you so much. So we're about to look at the final case study. But before we enter that, we've got one more question for you. And please do put your responses in the chat box. So what do you think happened when fast food restaurants such as Burger King and McDonald's, etc., introduced a salad? So I'll give you a couple of minutes to put in what you think happened. Do you think they were a mega hit and everybody ran out to buy them? Or you think they were less popular? So somebody said not many salad sales, so not many sold, nobody seemed to notice, they failed. Yeah. So it's really interesting, this concept of, you know, adding healthy foods. So interestingly, when McDonald's were doing research around, you know, what would encourage more people to go, they interviewed parents in a similar way that we interview parents and we engage them with our behaviour change processes. And parents said, oh, we need to eat healthily. Yes, if you did a salad, we'd eat a salad. And then salads were introduced in McDonald's and other burger restaurants, but they failed. Nobody really ate them. Sales were very low. And in many countries, they've actually stopped selling them now. Because the truth is, people, as one of the comments said, you don't go to a burger joint to get a salad. You go to get burger and chips. And so actually this concept of healthy eating in many ways is more in intention than it is an action, as these organizations found out. So sometimes we can ask people, you know, oh, if we created this new system, would you want to do this? And they say, yeah, we'd supply fruit and vegetables to the government or whatever it might be. However, it's only when you dig deeper that you find all the different barriers, some physical barriers, but many psychological barriers that actually stop the behaviour change. So when we develop new products and services, we have to not just think about the supply of them, but also how do we create demand for them. And with that, I will pass you over to Hadra, who's been tackling this very problem in Tunisia. Over to you, Hadra.
Sorry, for some reason my video is not working. Great. So thanks, Rubina, for that introduction. Here, I'm going to briefly speak about how we've used behavioral research, behavior science methods to develop a digital project in Tunisia. And I'm glad our colleagues from Tunisia have joined. Hello, Latifa. So they really know the project from inside out. So this is a project called the Last Mile Ecosystem, and it's a digital solution that connects smallholder farmers with school canteens through a network of transporters. And in short, it's Uber Eats, but it's healthy, and we're taking it to the last mile. And here, one of our problem definition was that although smallholder farmers produce majority of the world's food, but they do lack a lot of facilities, they lack the transportation, they lack a lot of opportunities to sustainable markets. And in WFP, we do have a lot of programs where we do connect smallholder farmers to schools, but one of the bigger problem is that they do not have transportation. And this was our solution through our innovations accelerator, which we implemented. And as you can see on the right side, smallholders farmers supply fresh food to the local government canteens. We've tested this in centralized models where transporters provide meals to satellite schools to about 1,500 kids daily. Then we also tested that in decentralized model with one kitchen and about 100 students. So this was tested in different models. And here the behavioral science approach we took was that it's a unique public-private partnership, and our slogan was that fresh food travels less. But you know, as many of you are from the UN agencies, we're all getting into so many technologies, digitizing, creating apps, just because they're also efficient and they make our work easier. But I think here we need to move beyond that, whether it's making work easier for the users, whether the beneficiaries want it in certain ways as well. And that's the angle we took, where we creating demand with our users, with our beneficiaries to demand this certain digital product as well. So these are the screenshots of the app. We finished developing a prototype a couple of months ago. We have many users in this app, as you can see. We have smallholder farmers, we have chefs from the canteen, we have local coordinators who manage the canteen, we have regional government employees, we have transporters, we have storage guys. So you can see that there are many users involved in this app design. And here we use two different processes to design this digital product. One is user experience research. Possibly many of you would know that this is a popular research method which targets users and see interactions between each users to design a product. And then we also use demand creation behavioral research, where we understood from a more emotional angle on whether they would demand this service as well, because ultimately our goal is that children get to eat diverse food from the local market as well. So this is in a very simplified way the process we have used, how this both user experience research or UX research and demand creation research went hand in hand, where we do this value proposition with different users. It's a really immersive experience where we're in the field, we're following the journey of the users from day to night. What are their daily habits? What is their life like? We do user interviews, and interviews are also focused on a lot of emotive elements, like you've seen from the previous presentations of Jordan and Palestine as well, where we asking what gives them hope, what are their future aspirations. To the farmers, we ask the same questions to the parents and the children, mostly about which food makes them happy. So that's the more behavioral emotive side as well. Then these are more technical terms in order to get to the development of the digital product, where we do user stories, we do journeys, we look at the data, we do the feature prioritization, then we develop wireframe and do the testing. And testing is also done with the users, how they interact with the product as much as they see it. And at the same time, we're also doing a demand creation qualitative research. And here one of our findings was that many parents and children don't really know about or care about local produce, but they care about organic produce. So these were also the terms we sort of worked around as well. So some of the findings of our behavioral research and the UX research were that us who are developing the digital product, we are not the customer. I am not the smallholder farmer. I am not the chef. I am not the government. So I think only these are the people who are experts of their own lives. I think oftentimes in UN, we develop these programs as well. Oh, maybe this is what the beneficiary would need. Let's implement this program. But I think here we use really immersive process to give ownership to the users themselves, that they're experts of their own lives and we're there to learn from them. Second one is that the user's life also does not revolve around our product. So that's why we went also beyond our product and service and immersed into more behavioral side of how they function. And thirdly is that users won't just come to us just because we've built the product. The product needs to be useful for the customers to use it. And here, a lot of the mindset we've used in developing the product is a lot of empathy, a lot of optimism, telling the smallholder farmers that this product could help them in the longer term, given that it's in partnership with the government. We also embraced a lot of failures. We embraced a lot of ambiguity. We have to do a lot of iterations to change our product given the findings we found, and that also gave us the creative confidence to create the app, and that prototype was then approved later on as well. And finally, I think the supply and demand side we're talking about is the more holistic approach we have taken. Supply side is that we went in as active learners in the system to overcome the pain points in the system while keeping the parts of the system that work well. Means that we're not there to disrupt the system, we're there to work with the existing system. That's why from the supply side, this last mile ecosystem app was able to give market access to smallholder farmers, transportation availability. We were able to digitize the procurement system of the aim to digitize the procurement system of the government, which makes it efficient, no paperwork, and build the capacity of the staff as well. And here the demand side is that we have to look at it from two groups: the actual users of the app, as you saw, the farmers, the chef, the storage guy, but also we have to see the demand from the local community to value and demand the fresh local produce as well. So in a nutshell, it's important that we create a product that is not just easy to use, but also that people want to use. And such behavioral research looked at our product in a very holistic way and in an innovative way, which created a demand of healthy food among parents, children, and smallholder farmers. Over. Thank you from my side.
Thank you very much, Hadra. We've got about 5 to 10 minutes left. If there are any questions for any of us in relation to what we've talked about or what we're planning to do next or anything like that, either please put up your hand or do pop stuff in the chat box. If you're a bit shy, please let us know. I'm not sure if there is any questions or queries or comments. I'll just give you another minute to fill in, and just if you are typing something in, Nitesh, just if that is the case, do you want to, if I just hand over to you, if you just want to say a little bit about what we're planning next or anything like that?
Sure. I mean, that's always the case. We need to share and give them a little bit of thought-provoking ideas. So what we are planning, we have a plan, 10-year strategy now based on the work. We have a regional strategy on where we see each of these countries' work going. And we see how other countries can join us on this journey. So there is a comprehensive 2030 milestone plan, which has been developed and shared internally for WFP staff. So they understand more how SBCC can help them achieving their goals at the strategic level, but at the sustainable level. That's one. Second is also the team which have started to work in country office will continue to get support to scale up, because our idea is not to stop here. We need to continue this journey. And I personally think the work of behavior science is, as I said in the morning, and I keep saying it, the behavior science work for WFP, as not only for nutrition, for WFP in general, should be the software work. WFP is known for the hardware of delivering food and getting where we need to reach, but the software of understanding if that food has created an impact on which level and how. It's not about numbers, it's about people changing the behaviors of the diet. We all know pasta came from some other part of the world in Italy, but people in Italy eat pasta. We all know how we got potatoes and tomatoes from different part of the world in our diets today. We changed our behaviors and we eat those food. It required some work, and it required some nudges, and it required some adaptation. And I think the great advantage of WFP's work is we work very closely with the beneficiaries at a very field level, where we have that opportunity to influence their behavior, not change it, but influence certain behavior for the nutritional outcome, which are becoming an alarming question. We're talking about food systems, we're talking about the health systems. Now we see with the pandemic, it is very fragile state of affair. If any questions are there, let's take those as well before we close the session.
There's
what
one
challenges
that's come
they
in.
face? Yeah, what is this? Do you want to take this, Rowena?
Yep, I can take it, and then Lama might want to add.
Okay.
So when we did the research in Jordan, the thing that struck us was actually people had really good knowledge around nutrition. They They could explain what anemia was, what foods they needed to eat to avoid it, what the risks were. Similar with Palestine, actually. So awareness was pretty good in Jordan. You know, they knew that grilled chicken would be healthier than fried chicken, and yet at the same time they went with what was delicious. And I think this is where those cultural and recent history dynamics are really important. So as Lama was saying, actually often within the refugee camp setting, they would give fried food or cans of Pepsi or Coca-Cola, etc., or sweets and cakes as a treat to their children, because they wanted to see their children smile there and then. They wanted that immediate gratification. And so actually those longer term health consequences, they were on the whole aware of them. They didn't know the ins and outs, but we don't necessarily need people to know the ins and outs to change their behavior. But they did know roughly what was good and what was bad, and what they should and shouldn't eat. However, at the same time, they felt guilty for being in that refugee camp and having their children in that situation. And they wanted to make life a little bit better, a little bit sweeter, you might say, there and then. So it wasn't really a knowledge gap. They knew what they should and shouldn't do, basically. Lama, I don't know if you wanted to add anything to that.
Thank you, Rowena. I think you, as a mother and as a nutrition specialist, I do understand where people's concerns come from. So again, there's not an issue or not a major issue when it comes to knowledge of healthy food versus unhealthy food. It's more of the foster power of children. And as you mentioned, sometimes we don't know what alternative approaches that we need to use in order to give the best and healthiest food to our children. Thank you.
So before we close, Rowena, I think there's another question. There's how did we convince farmers to use the digital product? We don't have to convince them. We have to use with what they are comfortable with. We have to develop on that. If you push things which they are not comfortable with, we are not going to have that sustainable reach and sustainable way of looking and changing things. So our approach is not to change it. As I was saying, it's to look at it, what they are comfortable with, what makes their life easier, what they want that is missing for their life and the work. How to change behaviors in school children when groceries still sells fast food? Yeah, that's a good question, Latifa. I think there is no one answer which fits to this question. Behavior of the school is not about school children. It's about what you tell them in school in terms of sugary drinks or in terms of sugary content snacks. And this is what we are doing in Jordan. I think what we are doing in Jordan will help you understand how we are trying to nudge school children into eating and looking for better, healthier options in food. As long as it comes from them, it will have an impact, no matter how many grocery stores are around the schools. School children needs to have that understanding that they are deciding what they eat and what they're eating makes them happier and healthier. Currently, they are in a phase where they need help. And I think that's where the dilemma is the parents, how the parents give up on the peer pressure and on their nagging from the kids on what they need without explaining or without understanding how it will affect on the long term. And that's where we are working now. It's not an easy task. Rowena, when she started with me, she talked to me about the England example of the sugar tax and how the schools were trying to bring in more healthier food. So it's not easy anywhere in the world where we are having the same challenges, but I think we are learning a lot more and we will be able in position to influence a lot if we are looking at the behavior aspect rather than looking at the big issues, which are to ban the sugar, to put on the sugar tax, or to prohibit any shops around schools. These are what I call them a big game ticket solutions, but they are not going to change behaviors of the people. Ultimately, if the people want to have a sugary snack, they will walk 1 kilometer from the school and get it. So what is it that it will change? And that's where I think we are working on. And I'm sure Rowena is thinking about what should I tell about the England story. Go on, Rowena.
No, just one point to add on that. So in the UK, in a lot of the local governments have banned fast food joints within a certain radius of schools. And as Nitesh was saying, they just walk further, or they bring them into schools and eat them secretly. And anybody who's been to the UK know that we have a growing obesity and overweight problem. So really, sadly, that just using those control mechanisms in isolation, I don't think gets the sustainable behaviour change we need. But I was just conscious, there was one final question, Nitesh, that came in from Brit, just asking about the terms SBCC and behavioural insights and how these terms are often used together in the health sector. And how we see the two of them joining together. So just to answer that, we have this SBCC planning process that we follow, which was the slide with the circles on. But when we talk about behavioural insights, we're talking about what commercial marketers would call those emotional hooks, or what I used to call when I worked in commercial marketing, those emotional hooks. So those things that would make people, those things that would make people tick, that resonate with them, similar to how the Behavioural Insight Unit in the UK talk about it, something that rings bells with people, that resonates with them. So when we talk about behavioural insights in our work, that's what we're referring to. And we use those key behavioural insights to then develop the interventions. So all those interventions are not just developed based on what people say works or what doesn't work elsewhere. They're developed based on that formative research we've done with our target audience, and then are co-created with our target audience. So I hope that answers the question for you, Brit. And over to you to close, Nitesh.
Thank you, Rowena. Thank you, everybody, for taking time and joining. I think it has been a wonderful week. If you have listened to the other presentations, I think thank you, UN Network, for giving us the floor. The more we share about it, the more we ensure that we are on the right path, and we are making sure that whatever we do in the area of nutrition and beyond in WFP has a sustainable impact on the beneficiaries' lives. Wishing you a very nice end of the afternoon and weekend, if some of you are having a weekend. Thank you. Bye-bye.